Hi, for my substance abuse project, I decided to do alcohol use in pregnancy. So there is no safe level of alcohol consumption during pregnancy. The harmful effects of alcohol on a fetus are 100% preventable. The only way to prevent harm to the fetus during pregnancy is to abstain from alcohol during preconception and pregnancy. Alcohol use in pregnancy affects up to 10% of women, while 2% of those women continue to binge drink during pregnancy. In the United States, 1 in 9 women admit to drinking during pregnancy. The CDC found that women from 35 to 44, college graduates, and unmarried women were highest ranked for those partaking in alcohol use during pregnancy. It was also seen that this group of women were least frequent to be screened for alcohol use during prenatal visits. All women, regardless of education level, race, ethnicity, age, and other social determinants, should be screened on a regular basis for use and abuse of alcohol and other substances. In 2016, the CDC reported that in Massachusetts, women from the ages of 18 to 44 years old, that was 63.1% of women consumed more than one drink within the last 30 days, and that 29.1% binge drank. Women between the ages of 18 and 44 are considered childbearing ages and should use caution when drinking alcohol if they're planning to become pregnant or are currently pregnant. And binge drinking is defined as drinking more than 4 drinks on any one occasion in the past 30 days. So maternal risks include an increased risk for infection, placental abruption, and spontaneous abortion. Exposure to alcohol to the fetus at any point during the pregnancy can be detrimental and cause life-altering birth defects. So regardless if a mother's drinking the first week that she's pregnant or the very last week that she's pregnant, it can cause harm to the fetus. Drinking alcohol can also lead to liver disease, digestive problems, cardiovascular compromise, diabetes complications, eye damage, bone damage, neurological complications, immunosuppression, and an increased risk of cancer and medication interaction in just the mother. For the fetus, alcohol can lead to low birth weight in infants, restricted fetal growth in small for gestational age babies, congenital anomalies, preterm labor and birth, and neonatal depression. The leading cause of fetal alcohol spectrum disorders is caused by women drinking alcohol. There are 4 categories under that umbrella. So there's fetal alcohol syndrome, which is the most severe. So characteristics of that include growth deficiency, central nervous system dysfunction with developmental disability or brain damage, facial dysmorphisms such as a short philtrum, a thin upper lip, and a short distance between the inner and outer eye canthus. Alcohol-related neurodevelopmental disorders include intellectual, behavior, and learning disabilities and problems with behavior and learning, academic difficulties with math, memory, attention, judgment, and poor impulse control. Alcohol-related birth defects include cardiovascular, renal, and skeletal abnormalities in the child, and neurobehavioral disorder associated with prenatal alcohol exposure creates problems with thinking and memory, behavior, and activities of daily living. Fetal alcohol spectrum disorders are entirely preventable, and the best way to do so is for the woman to abstain from alcohol during the preconception and pregnancy phases. Fetal alcohol spectrum disorders occur in 6 to 9 out of 1,000 children in the United States. As I said before, the timing of alcohol consumption does not matter, but there has been seen that alcohol exposure is positively correlated with the cognitive behavior and behavioral problems manifested in a child affected. This is what a child with fetal alcohol syndrome would look like. You can see the examples that I had stated earlier on the children on the left, and the photo on the right shows exactly where you would find those dysmorphic features. This photo, you can see the development of the fetus from week 1 to 2 all the way to week 38. So the dark purple represents the major defects a period in time where major defects in the body structure can occur, and the light pink is periods of time when major functional defects and minor structural defects can occur. The little black dots that you can see on the fetus show the location of where a defect could occur during that time. So you can see that drinking alcohol at any stage during pregnancy will affect the fetus in the end. So what would a mother say she feels like when she comes to a prenatal visit? Some of the things you would want to ask her is how many drinks that she has in one day, 1 week, 1 month, or over a specific amount of time. A mother might have a strong craving of alcohol. She might be complaining about how she's unable to perform daily life activities without using alcohol, so she can't go to work, can't go to school, can't do home life things without having a drink before she does them. She might be giving up activities that once brought her joy. She might be using alcohol when it's unsafe. She already is while she's pregnant, but she might be driving, putting herself and other people at risk. And she also might have some of these symptoms if she's intoxicated. She might have inappropriate behavior, unstable moods, impaired judgment, slurred speech, impaired memory, and poor attention span, poor coordination, and she might black out. And some withdrawal symptoms include sweating, nausea, vomiting, tremors, insomnia, anxiety, agitation, seizures, hallucinations, and restlessness. In an objective standpoint, you might want to check a woman's blood alcohol level. Of course, because she's pregnant, it should be 0 due to abstaining from drinking alcohol. You might see an increased heart rate and blood pressure, irregular heart rhythms, and she might have a low temperature, or she might have a fever if she's withdrawing from alcohol. Some differential diagnoses would be depression or other mental health disorders, including post-traumatic stress disorder, schizophrenic, bipolar, and other substance use disorders. It can be seen that in traumatic situations, it might increase the risk of alcohol consumption. Or this might be a family history issue. There is a genetic component to drinking, and it's been seen that there's a higher risk of drinking for those who have family members or close relatives who were alcoholics. Prenatal care and monitoring. All women should be screened regardless of their social background, race, ethnicity, age, education level, and other social determinants. Screening should occur at an initial visit and should continue regularly throughout their prenatal care visits. So this should be done in all trimesters. It's recommended from the CDC that you screen, provide feedback, and then work together to reduce drinking if a patient is motivated to do so. Alcohol dependency can also become an issue. Say a woman was drinking prior to becoming pregnant and she can't come out of her ways. You can recommend things like Alcoholics Anonymous or Women for Sobriety. Dependency can really make it difficult for a woman to stop drinking. If she had a problem prior to drinking alcohol, she might benefit from seeing counseling and other healthcare professionals in order to get their drinking problem under control. So mental health specialists, substance abuse treatment centers, behavioral treatment centers, and of course, if a woman has to withdraw from alcohol, it is medically advised that she does that in an inpatient setting. Support systems should also be assessed. Husband, wife, partner, parents, family members, friends, seeing who's in the life of the woman and who can help her with abstaining from alcohol. It's important to stay away from social situations, parties that involve alcohol, get rid of alcohol in the house, and a woman needs to be honest with her support systems. Sometimes a woman can be hiding her dependency from her family members, so it's important to include them in your assessment if the woman allows. Of course, abstinence is the only way that we can prevent any fetal alcohol syndrome disorders. A woman can also try alternative psychotherapy such as yoga, acupuncture, meditation. It also might be treating an underlying disease. Of course, family history would be something hard to treat, but making sure a woman's mental health is in a good standpoint to make sure she abstains from alcohol. And the use of medications, disilphiram and naltrexone, are not recommended and not safe in pregnancy. There's little studies to show that the risks of taking the medication does not benefit in the long run. Some of the legal standpoints of alcohol use during pregnancy. State laws can force legal actions such as civil commitment, involuntary treatment, or protective custody during pregnancy, or with temporary or permanent removal of child by Child Protective Services agencies after birth. As of 2015, 36 states had laws requiring one to report the use of alcohol consumption during pregnancy. The timing of reporting requirements vary by state, whether you report it during the pregnancy or after the birth, and whether you need the level of alcohol use triggering reporting requirements also varies. So for scholarly evidence, I found 3 articles actually written by the same team of authors. They performed the same studies but in different regions of the United States. So each study looked at different cohorts of first grade students. They assessed each child for physical growth, dysmorphology, neurobehavioral aspects, and they also interviewed their mothers. So you can see that in the Rocky Mountain region city, there was 38 children diagnosed with fetal alcohol syndrome disorders, and they were the second highest prevalence in the collaborative studies. The Midwestern city had 44 children diagnosed with fetal alcohol syndrome disorders. And the southeastern country had 49 children diagnosed with fetal alcohol syndrome disorders. It's interesting to see whether the region has something to do with the occurrence of fetal alcohol syndrome in children. These are my references and more, and then my picture references as well. Thank you.